Hi, I'm Cindy.
And I'm Danielle.
Welcome to Unapologetically Females.
We wanted to create a fun, non-judgmental space where women can talk about their shared experiences.
Here we will normalize the challenges we face as females living in a society that dictates unrealistic and outdated expectations on what a woman should be.
Together, we hope to cultivate a supportive community of women who empower one another to courageously live unapologetically.
A quick disclaimer before we get started. Although Cindy and Danielle are licensed therapists, this podcast is not to be interpreted as therapy or a replacement of therapeutic services. It is strictly a conversation between two women about their experiences in the world. If you liked today's episode, please make sure to like and subscribe below. Also, follow us on all of our social media platforms at Unapologetically Females. With that being said, we hope you enjoy this episode.
We are back with another episode, and today we have a special guest that Cindy will introduce for us today.
Yes, so we have the pleasure of having Dr. Jennifer Geoghegan from Galli Plastic Surgery here in Scottsdale. And Dr. Geoghegan, you want to tell us something about yourself?
Ooh, I am a plastic surgeon for 15 years. I'm a mother of 8-year-old twins, and that's about it.
Okay, well, she's being shy. So I have known Dr. Geoghegan since college, and she is unapologetically female, also an inspiration to many women, and what she's done with her life has been amazing. From being a physician in the burn unit to reconstructive surgery after mastectomies, correct?
Yes.
So generally when people say plastic surgeon, we think, the Kardashians. And this is a little bit maybe of what Dr. Geoghegan does, but she is a good human and inspires us all to be good humans. So thank you for being here today.
Absolutely. Thank you guys for having me.
I am super excited because I just have all the questions. I think I would love to hear a little bit about so starting off out of school, you went into burn unit was your first
I would
role?
say, so when we, as someone who wants to go to plastic surgery, we finish medical school. About your third year of medical school, you decide what specialty you want to try to get into. Then you match, or you learn your match your fourth year. Then you go to residency. So my residency, I was lucky enough to get a combined program. So I did 5 years learning plastic surgery. The first 2.5 are general surgery. And then the last 2.5 years were plastic and reconstructive surgery. So burns was a good part of that at our program. So we had an adult burn unit, and then we also had a Shriners, like a regional Shriners hospital. So that meant we did pediatrics and orthopedics for any child kind of pretty much around the world that was associated with a Shriner. They can get flown in and get free care at the facility.
That's really cool. So what led you into plastic surgery? What drew you to that specialty?
I would say variety. I don't ever like doing the same thing. I think I've known since I was a small kid that I wanted to be a surgeon or for sure a doctor. And I just always loved science and been good at science. I think throughout medical school, I looked at different kinds of surgery, pediatric surgery, OB-GYN, delivering babies it's like a miracle every time it goes well. And then when it doesn't go well, you're like, oh, that's not my jam.
Right.
And I think only working with women scared the bejesus out of me. It's like, you got hormone of every nurses, hormone, mostly obstetricians now are all women. And then all your patients are women. I'm like, I think I might have gone insane if I had done that. But it was really a mentor. So I had a mentor down in Tucson for the first 3 years of medical school. And so you worked with her. I worked with her for the first 3 years, and she was a pediatric surgeon. And so I loved doing it, but she was the one, she was like, I've gotten to know you for 3 years, and you don't want my life. I'm not married. I've got a boat in San Diego that I never get to use. I don't have kids. We're on call every third night. Do you really want this life? You should go try plastic surgery. And so she suggested it. I went and did a rotation, and by the end of the rotation, probably by the first week, I was like, I love this.
Okay.
I was like, went with a plastic surgeon in Tucson, and it was like you could go to the VA and work with big skin cancers and all the problems that those guys have. We did cosmetics, we did pediatrics, we did trauma, like plates and screws and all sorts of stuff. So again, it's like that variety. I was like, this is man, woman, child, faces, feet, whatever.
Right.
It didn't matter. You could work on everything if you wanted to.
Wow. So now you're more, would you say that you specialize or you work mainly in cosmetics at this point?
I do a good amount of cosmetics now, and it's kind of transitioned over time, but I would say my emphasis is still, I do mostly breast and body, so I don't do burn reconstruction anymore. I did a lot of it at the beginning, and a lot of trauma at the beginning, but now I just do breast reconstruction. So after mastectomies or after breast cancer, whether you've had a lumpectomy or radiation or mastectomies, I do breast reconstruction and then cosmetics.
Okay. And over the years, I'd imagine that there's been, everything evolves. There's evolution. And so when I think of a plastic surgeon, I think of an individual coming into probably just because I think of myself. Like, I'm going to walk into an office and be like, make me this. Like, here is the picture, or here is the, so this episode is about beauty trends. A lot of beauty trends in today's world.
And standards.
And standards.
What's expected.
Right.
Or,
And so I guess what do you experience in your role when you see patients come in? Are they bringing you pictures? What is the most desired look, I guess, and how is that kind of evolved over time?
I think that it does. I don't know if it's different now, because now from when I started to now, everything follows a lot more. Like, people are inundated with photos of what they're being told is the standard, or what you should look like, or what's acceptable, or what's expected. And I'd say when I started, that was not the case. It would be like your main source was television. So I would say, like, you think of the 90s, and everybody wanted to look like Pamela Anderson, and that was the standard. It was, I need ginormous, fake-looking breasts. And then, like, as trends change. So, like, right now, it's more athletic. I think at least for the clientele that I see, no one wants those breasts anymore. I would say everything is a little bit more
functional, maybe?
Exactly,
functional.
But I still think it really depends on your clientele. And I like to create, and I think therefore I attract something that is more of a natural or a more subtle aesthetic.
Okay.
I would say my philosophy is not to change your look. It's to just enhance or make the best version of you, not change you. So I'd say and I don't do a lot of face. My partner does more of all the facelifts. Neither one of us do rhinoplasty anymore. But I would say those procedures, I think, lend themselves a little bit more to people coming in and saying, I want to look like so-and-so. I want so-and-so's nose. I want this, or, whatever they're drawn to.
Right.
I do more breast and body, so it's more of a maybe a look. I want to look voluptuous. I want to look athletic. I want to look not necessarily like a person.
Okay. When you get the person exam, how do you manage those expectations? Because at the end of the day, like, everybody is an individual, and it's like you're never going to be able, I don't think, replicate that exact picture, person, body part of
Yes.
on somebody else. So it's like, how do you navigate that?
I think for me, it's having I'm pretty direct, and so I think having an honest conversation with the individual about what is truly obtainable and what are realistic expectations and what are unrealistic expectations. So I'd say I always use, and I'm like, God bless you if you ever listen to this, Tori Spelling. Those
Yes.
breasts back in the day of 90210
Yes.
are horrible. I'm sorry, whoever did that. Bad work. But so I always say people come in and they want cleavage, and her cleavage was this far apart, but that's someone's anatomy. So if you're expecting not her cleavage and you wake up with that, that's bad on me. I would never create that, but you didn't have a realistic expectation, or you didn't have a good conversation with that patient so that you could set the expectation
Right.
that that's what the only thing that you're going to get because that's your anatomy, and to kind of work through, okay, here's how we could approach it in a different way so that we don't end up with this, but you're never going to get this if we are starting from something over here.
That's so interesting to me because as laymen and as patients, as we come in, we don't think of the anatomy, physiology, science side of it. We just think, okay, well, this is what I want, and
Right.
make that.
Yeah.
Right. But not everybody's built the same.
Right.
And not everybody's gonna receive it the same.
Yeah, and exactly that's why some people will come in and they are like, my friend has 300 cc implants. I want 300 cc implants because I like the way her breasts turn out. I was like, well, 300 cc's on like each of us would look completely different. It might not fit. It's got to fit your bones. It's got to fit your ribs. It's got to fit your skin, your muscle, everything. So
Right.
it's a lot of, I kind of try to present, okay, I'm going to do these measurements. I'm going to look at you. We're going to do an examination, and then here are the options that would work best for you. And then you can try to say, okay, I want the most natural. I call it Jessica Rabbit or push-up bra look. I want this, or kind of just say these are the realistic goals, and then
Right.
and I use our own before and after pictures to kind of show, okay, here's someone with a similar anatomy. No one's ever exactly the same. Someone's similar, so I think this is what you could actually achieve. But I do ask people to bring in their wish pics because I just want to see
Yeah.
what's in their brain. Sometimes you can tease that out of them talking to them.
Right.
And sometimes, no, they're saying one thing, but the photo they show is completely different. So, like, it helps me because then I get a frame of reference for
Right.
what language they're actually speaking.
Interesting. You mentioned, so in the past, what we based beauty standards off of, television was our main source. Maybe some magazines, a little
Magazines,
People
yeah.
magazine, us,
Yep.
you get your tabloids. And now it's like we are consuming media so much,
Yes.
and it's at at our fingertips 24/7, where you can just you can scroll and look, and there's just everybody's out there making a living on these platforms, and so sex sells. That still is true.
Yes.
And
Yes.
so we're putting out all of this information, and then people are retaining it, receiving it, and then I think at some point it starts to, from a mental health perspective, your view of yourself, your self-worth, your value. It's like, if I don't look like this because this got the most likes, or this got the most, comments, or the most people attract, that voiced opinions of, you're hot, or whatever that may be, and validating the picture, the tiny waist, whatever it is. How do you feel like that has influenced your profession and people's view of what what pretty is, or what hot is?
Yeah. I think that the more people are exposed to, and just like you say, we're all exposing ourselves daily. Like, people wake up and and open their phone.
Right.
Before they've brushed their teeth, before they've done anything, they've probably gotten on their social media to just see what's going on. So I think it's just setting new expectations and putting a lot more pressure on people.
Pressure. That's a good point.
I think it's not for me. Thankfully, I think I live in a little. I do live in Scottsdale. I practice in Scottsdale, so I think it is definitely the spot of Arizona where people associate plastic surgery or come to for plastic surgery, but I don't see my practice. I don't draw people looking for like the latest TikTok trend.
Okay.
So I think I get to
Interesting.
kind of stay out of that bubble, or I don't put myself on those platforms either. So I'm not on there. I'm not creating TikToks. I'm not,
You're not marketing to that audience.
exactly. I'm not doing that. So it's somewhat purposeful by me, but I definitely see and would feel the newer pressures that people are under.
Right, because there's so many. Just in like some quick searches that I did, a lot of you can find. I mean, there was tons of surgeons, plastic surgeons that are filming during surgery, that are posting the procedure, that are posting, before and afters, doing like 6-month follow up or year follow up pictures, and it's like. I mean, I'm indifferent on like, whatever. If that's your business model, great. If that's how you're going to market, great. And for those individuals who feel comfortable sharing their insights with the world, then have at it,
Yes.
more power to you. But I mean, that's just, I even think that's a whole other added layer to when individuals are consuming. It's like, oh, if I go in like, and I'm watching this procedure happen and here's, I can achieve this level of whatever they're trying to achieve, and that's being marketed like that, to draw people. It's definitely a marketing tool.
Yeah, absolutely. And I would say even our office, just as I say, I'm not creating TikToks, but we are doing before and afters.
Yeah.
And I think you have to, like in this day and age, kind of share some of that stuff online. So, whether it's, like you say, creating a video in your OR or creating it with people's before and afters or kind of showing an experience, I'd say that's more what I like to feel like is here's like an expectation so that people would say this could be my experience by coming to Dr. Geoghegan.
Right.
Or then trying to give them a view of a look that they should want. More so, I'd like to say, here's what the experience looks like with our office versus
here's what you could walk out if you're
Exactly.
looking like, No, that's a good perspective. I think I'm curious what the process is. So walk me through kind of like a patient experience, and from your seat, if you could also share, are there like mental health screenings, or what does, I have no idea.
Yeah.
So what does that look like?
So I would say, for our office, anyone interested, they will usually call the office. If you're already a patient, come in and see us. New patients, we try to have a conversation. So we have patient care coordinators or like an experience coordinator at the office, and they call us to say, what are you interested in? Tell me more about that. Tell me, like your goals and your expectations. And we try to, even before they've met myself or my partner, are they a good fit for the office? Are their expectations lining up with what the doctors like to do, or something like that? Then if it seems like everything is lined up, then you come in and have a consultation. I would say for me, it's that time frame when it's not a formal mental health screening. Like we don't have a questionnaire. I don't have a questionnaire, but I'm really trying to get to know the patients. I almost tell patients it's like an interview. You're interviewing me, and I'm interviewing you. And if there's things that you're saying or things that you're not saying, then we don't have to work together.
Right.
And so I think that's my screening. And then for procedures where I really need to have like mental health screening, or I just get like a red flag, then I would send them to someone or ask them to send to someone. And I would say probably for my profession as a whole, gender dysmorphia or the whole transgender community, I would say that's probably for me one where that comes up most often, or where we would require it for surgery. So we would say, have you been living as the gender that you identify as? Have you been on hormones if they're necessary for your transition? And are you working with a therapist? And do you have a letter of clearance for them? Because we're making changes that most of the time can't be undone.
Right.
So I'd say that's the one where it's a requirement, but I'd say most other surgeries, if you're, coming in for a syringe of Juvederm or even a tummy tuck, if you're coming in for liposuction and a tummy tuck and you come across not with any, no red flags to me for body dysmorphia or something unrealistic expectations or things like that, then no, there's not a formal mental health screening that we would require or do.
Go ahead.
Well, body dysmorphia, you bring up a good point. So being that, we talk primarily about females, what percentage of your practice would you say is females? And what is the number one reason you see that they come in for?
I would say I treat primarily females, so I would probably say 95%. I do very little, and I'd say very few men, and it's primarily body contouring that I would see them for. And I would say mostly body and breast contouring is what I see my patients for, whether it's breast augmentation, whether it's breast reduction, and I do those equally. I love breast reductions. Those two things, or kind of just body contouring in general, whether that's liposuction or skin removal. So I'd say, mommy makeovers with like a tummy tuck, or people who've lost a significant amount of weight, or things like that are primarily what I'm seeing patients for.
And do you feel like primarily they have a realistic view of what their outcome's going to be? I mean, I know you deliver a realistic view.
Yeah. I would say for the most part, yes. I think fortunately for me, very few people, and I think I've been in practice for about 15 years, so now you can kind of feel those people. So
Sure.
if it's someone that I feel is really like might or probably has body dysmorphic, I'd rather have that upfront conversation, and instead of trying to maybe send them to someone like you and then work with them to get them through surgery, I think that they're better off not having surgery, and because it's not going to fix them, it's not going to provide what they're looking for, and so if I get that vibe from them, I kind of just have that conversation with them. I think just acknowledging it for them might help them more, and I don't know, like, y'all are the experts on that, but I think just acknowledging, hey, you're a tiny person, and you are seeing that you have a lot of excess skin, or you are seeing that you have these pockets of fat. I am not seeing the same thing as you. In my professional opinion, we're not on the same page. I don't see the problem that you're, addressing or wanting me to address. That I don't think, any methods that I have are going to get you the outcome or the desire you want. And so I don't think surgery is the avenue that you should be, barking down.
Right. I mean, it's a good point, because a lot of doctors play a part in mental health counseling, right? And day to day, you play a very fine line too, right? There is a lot of mental health that you have to take into account when you are assessing a patient. Yeah, and how does that feel? Does it feel like a lot of responsibility? Has it become more natural in the last 15 years as you go along?
Definitely. So I'd say I definitely feel like I've gotten better at it over time, or it's not as uncomfortable. I think at the beginning, it's definitely not something you're taught about. Here, do a report on body dysmorphic because this is something that will be in your profession. So learn about it, but not in a, there's not like formal more than read about this and learn about it, but it's like more exposure over time and making a mistake and saying you tried to do a surgery for someone and make them happy and seeing that surgery could never make that person happy and remembering these are the things that they said, these were the feelings or the red flags that they threw out there that you missed the first time and don't miss them.
Right.
Don't miss them anymore.
Yeah, that's fascinating. How do you navigate that conversation? Because it's done and over with.
Yeah.
Like, then what? Like,
Yeah, exactly.
Where do we go from here?
Exactly. That is it's a way I definitely say to myself, to the staff, it's easier to have that conversation before someone gives you money than to have taken their money and put their faith in you that you're going to be able to achieve their goal and have that conversation that their goals weren't met after. So it's
I can't imagine.
Being upfront and seeing that this is just a person who's struggling with something that I, with my bag of tools, am not going to be able to fix for them, and knowing that ahead of time is definitely the challenge.
Here's where I think you're so gifted is that and you're able to do that, and you're female, so that helps, I think, in communicating with other females and knowing maybe how they feel in that way. But not all surgeons or doctors are capable, or people in general are capable of that. So I think that's such a gift and an important part of your practice, for sure.
Thank you. I do think like there are studies out there that being a woman physician makes you a better physician and a surgeon for sure. We have better outcomes because most of the time, I say most because no one is ever all one way, but they listen. So I'd say when I'm seeing patients, especially if it's a revision patient and they haven't had a doctor, they will say, you've just taken more time listening, more time talking with me. I feel better understood. I feel like we're on the same page, or just for taking the extra 5 minutes, 10 minutes just to listen and hear. And it might have nothing to do with what they're in your office for, but they feel listened to, they feel heard. And so I think that connection, and then you get to see that person on a different level or a deeper level, and then you actually know if you can help them or not.
Yeah, I think that's amazing. Good for you. How about the patients that come in, does it become have you ever had patients that it becomes a chronic, chronic's probably not the word, but they get almost addicted to, once they've had a few surgeries, then they want to fix the next thing and the next thing. Is that something that you ever see, or is that?
I would say a little bit, but not really.
Okay.
Thankfully, I would say the most, I almost call it, like for us or for me, there's some people who just need staged procedures, and so we're kind of planning that ahead of time. And I would say our weight loss patients are a great example of that, because you can't do all their surgeries at once. And so I'd say maybe one time they get their abdomen done, or sometimes we go all the way around and call that a belt lipectomy, and say that in and of itself is a big surgery. So or sometimes we can do breast and arms or thighs, or kind of as their journey progresses, or they lose more weight, then you can kind of add additional things. But for the most part, like truly other cosmetic things aren't the same. I would say probably, and I still do some fillers and Botox and things like that, but I would say on that side of it is where I see people getting more the addiction. So I would say not necessarily for surgery, but it's like lips, like those housewives' lips. I'm like, those are never gonna be what are walking out of my office. I'm like, those are crazy, but there are people who do that. They get one syringe and then they're like, oh, it's gone. My lips are small again. And I was like, you have to show them their picture, and they're like, oh, they are still a little bit bigger, but they will try to get someone else to inject them, and then they just get bigger and bigger and bigger. People, even with their Botox, they're like, oh, I'm starting to move a little bit. I have one line, and they're, back for a little bit more Botox. So I think maybe with those things, I'd say a lot more common than surgically.
Possibly partly because they're easier procedures.
Yeah.
And, we see that on social media and in some of the shows that we watch, and that's interesting.
Is there anything, so going to like Botox and fillers, because it is more accessible, financially affordable, things like that. Do you have a line? Is it like, we're not doing anymore? Like, how do you kind of navigate that, and where is the cutoff,
Yeah, for me, again, I like a very natural aesthetic. And
Right.
so for that person, if I can say, hey, your lips are big enough, your cheeks are big enough, you don't need more. I'm easily having that conversation with someone and saying, no, you don't need any more.
Right.
You're good.
I'm not the one.
I'm not the one that's,
Okay.
I'm not that person.
Are there any indicators during like your consultation that you're like, these things, I'm sure there's a lot for different things, but like that rule you out, whether from a mental health perspective, from a I guess probably even from your, I don't even know what the right vocabulary is for that, but like anatomically, like is there anything where you're like, that's just not realistic, or not even necessarily realistic, like it's not safe, or that this rules you out completely? Like, what are those types of things? And then are people like crushed? Because I feel like you go in to get to that consult is like a lot, like mentally.
Yeah, exactly. It is. And for a lot of people, it is mentally, it's a lot, especially if you're gonna, it's not just Botox or fillers or something like that, but if you're showing up to see me and have a breast reduction, a lot of times you're getting undressed in front of someone that you don't know, you're being vulnerable, you're being naked in front of someone that you haven't met. So it takes courage for patients to come in and be able to go through that. So yeah, I can definitely, I think that's part of the reason why ahead of time we're trying to find out a little about that person and are there health issues that would prevent them or make them not a candidate for surgery, so that they don't even have to show up to a consultation and waste an hour of their time and go through that examination when there was no need. So I would say if they are just in general unhealthy, then you don't need to be having elective or cosmetic surgery. But I would say, like uncontrolled diabetes, or if they have bleeding disorders and they're on blood thinners, or some is a trickier one, or patients who've undergone transplant and they're on immunosuppressant drugs, so they don't have a great immune system and they'll be more susceptible to things like infection. So I'd say anything like that, and then those, I'm like, the transplant patients, I would say there are some of those who they got breast augmentation, for an example, before they had their transplant and were on those drugs. And then now that they're on those drugs, they have implants. And so when they have like a deflation or a rupture, and so you're like kind of in a stick. So then you have to really work closely with their physicians that are, helping with their care, so that you can either, if they want them replaced or just remove their implants, or so they say there's some scenarios like that, or cancer patients. Not all of them are getting the best of health. Some of them have BMIs where I would normally not operate on them, and I would get to a healthier spot, but they have cancer, and so you just have to work with their other physicians to get them in the healthiest place possible, or do temporizing things for them until we can get them healthier, or they're going through chemo, or they're in radiation, or different things that just kind of compromise their overall health. So so there's things that we would try to prevent them from even wasting their time coming into the office if we knew those things about them coming in.
Right. So as far as like, so beauty standards of today, I mean, we all have a different opinion, perspective on what's beautiful, what, you know, and managing that. And as a woman in this field and what you do, how do you define that?
I think that I personally define it. I like a natural aesthetic, and so I think not pushing to overdo, but just to kind of optimize what we're given, is kind of what direction that I like to go. And so I'd say probably just people meeting me, or people like referrals and things like that. I think that's the clientele that I draw. So I would say even if I'm doing like, you know, what's still kind of big, like gluteal augmentation. So I'd say getting your butt fat grafted is a very, you know, social media driven, Kardashian driven, that kind of thing. But I'm not seeing patients who want that butt. I'm seeing people who want a fuller butt or a more athletic butt, or as we age, a more lifted up butt. But I'm not kind of you know, putting out there or promoting those kind of things that are out there in social media, and there are people doing them in our community liking like that. But I would say for me, just optimizing healthy, athletic, youthful, but not anything that you're gonna want to be undone in 10 years because the trend changes.
That's a great point right there.
Point.
Yeah.
I'm like, you get that butt, and it's a lot harder to undo than you would imagine. So
I was going through that process in my head, like, well, how would you fix that? If you take it out, then there's a lot probably to nip and tuck. So they
contouring that back down and getting it to look nice is
interesting, because I think that, you know, you see even the trends of like the Pamela Anderson era. And I'm sure, have you seen that? You know, I want to go down now.
Absolutely.
And so what does that look like? I mean,
so I would say depending upon how much skin that they have, sometimes if you're downsizing an implant, you're having to sometimes do it in stages where their skin is so stretched that I take their implants out, let their skin kind of heal, and then go back and either do a lift and a smaller implant, or sometimes it's that you do have to do it in stages. And then some people, the trend right now, or it's been for the past couple of years, is breast implant illness. And so just the language around, and that was very social media driven. I'm like, in the 90s, it was, you know, on television. I think it was a Connie Chung special that kind of set off the whole, you know, silicone.
Georgia has no idea who Connie Chung is.
Yeah. And so I would say now it's more breast implant illness and fatigue and joint pain and a whole slew of things that could be related to implants, and we don't have a good test for that. I can't take out your scar tissue and your capsule and send it and say, yes, you have this label, you have this diagnosis, and now you're going to feel better, you're fixed. And so I would say that one, it's plus or minus. We, you know, been taking out a whole lot more implants with taking out that scar tissue and capsule, and some people, they feel better. And it was a fix, it was a solution for them. But then you have the patients who, they're like, oh, I love my implants and I don't feel better, and I still have fatigue, and I still have this, and now I want my implants back. And you're like,
oh wow.
I'm like, oh, do you really want your implants back? And then I'd say those are the ones, like, I'm
it's
like
a lot
really
on your body,
trying
your
to,
mind.
I'm like, now is the implant gonna make them happy again? Is it going? So it's like
effect,
exactly. I'm like, oh. So I'm like, those ones are a tough
the illness piece. I'm so curious, and again, I don't even think I don't even know if I have the right questions to ask about it, but I think we've all seen and been exposed to that line. You know, my implants made me sick. You know, I know somebody that said the same thing, and she got them removed, and I believe she shared that she developed I don't know if she believes the autoimmune disorder was developed because of the implants, but
yes,
nonetheless,
she also has an autoimmune, and so So that, what's the science? What research has been done? Where are we at with that? Because that is it's a buzzword.
It's a huge buzzword. So I would say, unfortunately, there is not great science for it. Like I said, even if people have autoimmune, so people will have Hashimoto's, people will have Crohn's, people will have Sjogren's, people will have all these different autoimmune disorders and get breast implants and do fine. So you can't even say that those where their body is already attacking itself will do better or worse with an implant. And like I said, I'll take out people's implants and maybe half the time they're better, and they will wake up from surgery, and the next day they will come in and see me, and they will be so happy. They're like, I already feel better. The poison is out, my implants are out, and I already feel better, and the impact is that quick, within a day. And then I have other people, they're like, well, I'm gonna give it 6 months to see, but there's not a test. I'm like, people always come in and say, oh, I need to do this because people have shown pictures on the internet there's mold, and so you need to send my things for my implants for a mold or bacteria or different infections, and we can test for that. So we can send their capsule to rule out that there was not an infection or there was not mold or there was not those types of things, but there's not a blood test or a pathology for their capsule to say you have breast implant illness. But it is a code. So there is an ICD-9 label that I think it's Medicare that makes up the codes, or that system, who has given a breast implant code, so that now they are able to bill for those codes, but there's not a test to verify it. So it's very interesting.
Does that turn medical? So for insurance coverage,
that might be not medical, or how do you prove it was medical, to a billable code to your insurance company, so that you can get your implants removed, where traditionally, if you got implants for a cosmetic reason, I just want them, I'm asymmetrical, I'm whatever your reason for wanting them was, you can now get them at least removed through your insurance company.
Wow.
Fascinating.
That is very fascinating. So how often are you seeing that? Like, I mean, if you could put a percentage on that, has it increased, decreased over time? Like, what does that look like?
I would say it's been like the past 2, maybe 3 years has been the highest that it's been in like the past 15 years of my career.
Wow.
Interesting. So you bring up a good point that you've been practicing 15 years. We've talked about that. How has your patient population changed in age since you started? Are you seeing younger people now? And do you think that is from the fact that we're able to, as you said, be on our phones from the time we wake up? We're inundated with pictures and such?
Yes.
Or
I'd say a little bit. I think more. I think as a plastic surgeon, I don't know if it's like just something that we do unintentionally as patients, or if it is more intentional. But I think your practice almost ages with you. And so I feel like when I was younger, patients were younger, and now as I'm middle-aged, I think more of my patients are middle-aged, but I do see younger patients. But I would say it's almost like surgery dictated. So what you do kind of almost drives the clients or the patients that you're going to see. So if you were someone who just specialized in facelifts, then you're kind of put into a box where you're going to see more 50s and 60s year old patients. And so I'd say, because I like to do mommy makeovers and weight loss and breast cancer, those patients could be 40s, 50s, 30s, 40s, 50s. And then so I'd say more people are having kids a little bit later now than I feel like at the earlier. And so that makes my moms a little bit older than they could have been, 15 or 20 years ago. But I would say breast aug patients are still, more so we see those in their 20s, but I have 50-year-olds show up for their first breast aug every once, and
You might see me at 50, you never know.
But I would say I think my youngest is brush reductions. So I love doing brush reductions. I think it's just mentally, and so some people don't want them for the attention that they receive. And so I'd say young people who aren't comfortable with that, maybe I see them from a comfort or a perspective that way. I would say also athletes. So I see a lot of younger athletes that are like volleyball players or swimmers or softball players or whatever sport that they're playing. Is just not conducive to having breasts out of proportion with the rest of their frame. And so I see those as teenagers. And so I'd say that's probably the youngest population that I do surgery for. That's not a congenital thing that a kid needs a plastic surgeon for.
And probably someone who specializes in rhinoplasty might see
Exactly
younger.
Right. Yep.
Yeah, that makes 100% sense. Yes.
So I feel like, back in the day, I think plastic surgery was stigmatized. I feel like as we've evolved as a society, there's less of a stigma around it. I mean, there's people that, like I said, with like the social media that will consent to, not covering their faces and not, they're not hiding. They're okay with sharing what they've gotten done. Have you seen that, or like how has that kind of played into your practice and with patients and the conversation even, or even in your personal life, the conversation? Did anybody in your personal life, have you run into people where you've had conversations where they're like, oh, like
they've ashamed you for
like
your profession?
It's like, oh, you do that, versus now where it's like, oh, can you do that to me?
Right.
Yeah. Yes. Very much so. So I would say it is, I think it's still mixed. Like as much as I feel like it's in our face and you see it so much, like you would think that it would be completely open. And I would say there are those people who are like, why aren't you filming me? Like, I would say especially younger people, like they assume we are all like, I would say the biggest one is like Dr. Miami. Why? Like he films everything. It's like live streamed, all of his surgeries. And I'm like, and so I had younger people, well, are you going to film me? Like, I'm marking them and they're like, where's the camera? It's like, why aren't you filming?
Wow.
Where's the film crew?
And so I'm like, it's not my jam. If you want me to take some pictures in there while you're asleep, I can do that for you. But
That's hilarious.
So there's from that to there are still people who they will not let you use their before and afters. You can't show them. They don't want to they don't want you to take their pictures. They're like, well, I have to take your pictures. Or there are people who even their ride that's picking them up, the person they're supposed to trust enough to take care of them, and it's their person. It could be their spouse. They're like, don't tell them how old I am. Or they just think think that I'm getting liposuction, but they've gotten a whole everything.
They're bandaged from head to toe.
They're bandaged from head to toe. But they don't need to know what I had done. Just they think I'm getting this. They think I'm here for whatever.
Wow.
And so don't tell them anything, or don't tell them my age was like last week in the office. I'm coming in, it was a woman coming in with her friends. So I'm like, you're coming with your friends? Like, how do your friends not know that about you? And she's like, don't tell anybody my age. No one knows my age. Wow. And they think that I've just said this, and I'm like, you're here with like the people, these are your tribe. These are the people that you trust. These are your friends. But I was like, people are still, I think they want to look and portray what they see on social media, but they still want to be able to, I was just born this way. And I think a lot of it is some of the social media people are very in your face and say, oh, I've had this done. This is why I look this way. I do contouring. This is why my cheeks look like this. I've had my lips injected. That's why they look like this. But I think there's also people on there that are using filters, and you're either not saying I'm using a filter or I'm using XYZ to
Right.
look like this, or I'm in shapewear that's so tight that I can't breathe right now, and that's why I have this figure. And so they're not disclosing why or how. They're looking a certain way, so I still feel like there is some of that hidden and hush, and people want to be able to say,
a good point.
I no, I don't work out. No, I eat whatever I want, and I look like this. I'm like, that's, not everybody is genetically blessed, so I would say that's not usually the case.
Well, even like when you see, I was watching something recently, and someone was crying on television, and I was so I kept rewinding it and playing it again because I was so fascinated because literally their face didn't move. It was like, whoa, like that's wild. So I was so fascinated by it because I was even like the eyes were trying. It was so tight. And so clean. And I'm like, is there a filter on that too? Because Cindy and I have played
we've
around
asked Georgia for filters before, and she's like, no, ladies.
Yes.
It's called unapologetic.
Yeah. So, I mean, just that piece of it is, and obviously that comes with privilege because you're not getting no movement like that if you're not keeping up on it, and you're not.
There's nothing natural that creates your face, or even a topical lotion that will get your face to not move like that, or not be puffy, or no wrinkles, or no spots, or no anything.
Right, and so that I think is so misleading because nobody's coming out. It's not like everybody who's getting these procedures done, or treatments, or even the lasers and the all that. Nobody's walking around with a sign that says, "Here's all my procedures," or "Here's all the services I get."
Here's how much work it actually took to get me ready and get me to look like this today. Like, I think that would be amazing if people actually got to see the celebrities or the influencers or whoever it is that we're looking to for those beauty guidelines that kind of just show up and look like this, but they've been getting facials and Botox and liposuction and this and that and all these minimally invasive things for weeks and months before this event to show up and look like this at that event.
Right.
And they have professional makeup artists
Yeah.
and professional hairdressers and someone to tape them and lift them and tighten them in their dress.
That's where I think it gets so dangerous for our youth, right? Is that it's so misleading, and yet we have very little control over what they're I mean, it's just out there, it's I have a 7-year-old daughter, and so what she views at just TV, she doesn't have social media like that, so, she's not exposed to that, but I mean she's exposed to even her older cousins, and seeing what beauty is through a 16-year-old's eyes, and and so I think that, that for the youth of today, understanding and knowing like those aren't natural, they didn't just wake up like that.
Correct. Exactly right. And I think that is absolutely the truth, and that it's the kids and maybe even the teenagers that don't understand yet that no one looks like that on their own. They didn't wake up like that. That is not like a natural, or they're seeing it as they're standing because they're seeing that every single day to look that certain way. But they, like you said, I have 8-year-olds, and like they don't understand that just doesn't happen. So my boys, for example, they're like, oh, I'm going to be a YouTuber because it's just like they're all millionaires, and I'm going to drive a Lamborghini, and I'm going to live in a big house, and it's going to be on the beach, and I'm going to make all these YouTube episodes.
My daughter
and
thinks
it's
the same
just
thing.
a given that I will be a gazillionaire, and and so not even just beauty, it's just like the standards of our life that we're holding ourselves to is even, well, you have to, like, when we go to a sporting event, well, are we in, they call it the VIP. They don't even say VIP. Is there a VIP section? Because the guy on YouTube gets to sit in this section, and there's the VIP part of the plane, and there's the VIP part of how like they like everything, like little boys, how they shop, like candy bars. And like Mr. Beast has a new chocolate bar, so we have to have Mr. Beast chocolate bars. It's like the things that you're shown that you want, that you should want, that are the best.
Yes.
The best clothes, the best lips, the best chocolate bar. It's like all that they see,
starts
and it
so
doesn't.
young.
Yeah,
It starts so young. The expectations and the standards that are set, that are put out. My daughter does the same. It makes me feel reassured. It's like, because she's the same. Mom, are you buying first class tickets?
Oh yeah.
It's like, oh, okay. Well, did you work today?
Yes.
It's like, so it's fascinating. Managing those expectations, and then getting kids to believe, because I think that's another layer to it, of they get it in their minds that it just is. That's just how life is. That's just how people live, or that's just how people look. And so the standard gets set, and breaking it, because kids know everything at a certain age. You know what I mean? It's like they know all, and it's, mom being like, that's not real. It's like, no, Mom, you just don't know.
Yeah.
Like
You
they were just genetically blessed, or they were just.
But it also makes going through that awkward stage so much harder. I mean, it was hard
Yes.
enough when we did it, but now for them, there is no awkward stage for them to see, right? So now it's like, oh wow, it's like 3 times as awkward, because there's no
one
example
posts
of
that.
awkward. But that awkward stage is so important in development.
Right.
It teaches us so much. It teaches us, how to be malleable. It teaches us self-love. It teaches us like so many lessons. And society and social media isn't showing us that stage.
Yeah.
No, and it's scary, because when you say that too, it's like we've seen, the increase, younger and younger, the increase in depressive symptoms, the increase in anxiety, and kids having so much anxiety that it's paralyzing to go to school even. And a lot of it is because of the external influences that they are taking in every day, and the standards that have been set to look like this or be like this, or have, my family has the, all of that. And I think that it's, we should be putting out the same message, just as much about, what I think that it's so important for us to acknowledge that these people that they're consuming and that they're taking in, and these lives that we're seeing, it didn't just happen.
Right,
It was they weren't born that way.
They weren't born that way. They did go through an awkward stage.
Yeah.
They did, and they had help.
Yeah.
Looking like how they look,
I think that that's just so
to be
important.
more honest, I think,
Yeah.
That's to be more honest.
and
That-
transparent with.
to wrap things up, from your perspective, the things you've seen, beauty standards, what do you feel like is the takeaway, the most important message? What from the women that you're hearing from, and where they're at in life, and just also from your perspective as a mom of 8-year-olds, like, what do you feel like is so important for people to know and understand?
I think like you are kind of headed, I think, on the transparency, I think is understanding that not all people have to look a certain way to feel good about themselves. Like, I think if we can help people feel comfortable in their own skin, but even if that is to be comfortable in my own skin, I need to have a breast reduction. Or if I am comfortable in my own skin, I've had 4 kids and my abdomen doesn't look like it used to. So to get back to me, if I could have a tummy tuck, I think the why, I try to always figure out the why when I'm seeing people. And if the why is to get back to me, or get back to where I'm comfortable in my own skin, I'm not trying to put on somebody else's skin to feel comfortable. I think that's a good why to have surgery. I think that person can be happy, that person can be successful, that person is going to get the outcome that they want. So if there's a way to show people more those types of scenarios where it doesn't matter what you are going to look like if you're going to be comfortable or be more comfortable being you. But if that you is smaller breasts, smaller hips, bigger butt, bigger lips, it's just comfortably you versus comfortably someone else because I see someone else that I'm supposed to look like.
Great point.
Yeah. I think for me, just hearing you talk about your experiences over the last 15 years in the field, I think the two biggest, I love that you're really big on like the natural aesthetic. Like, how do I just enhance your natural, what you naturally have, your natural beauty, whatever that is. And I think that's a really healthy way to look at going into it from your seat. Like, it just, to me, it's very much in line with, I think if I were, going into a surgeon's office looking for something that is very much in alignment with what I would want, and I think that putting that message out there, the natural message, and then also the transparency in all of it, of that, like, I did pay to get this.
Yeah, exactly. And it's hard. I'm like, even just aside from being a plastic surgeon, you get to just be a woman, just be female, and you're exposed. And so on the other side of it, you're like, oh God, this 20-year-old comes in, she's got horrific boobs. I wouldn't want to touch those breasts. And I'm like, I wish my breasts could look like that. I'm like, I need to work out more. I need to eat less. And so I would say you still feel those pressures, but I would say it's a hard point getting to be comfortable enough to say, I don't have to do every little thing that I could do. But it's hard to be a woman. I wake up with the same pressures. I'm like, oh God, I'm moving. I need more Botox. I wish my lips were bigger, and I want to go get that facial. But I'm like, I think those pressures are on all of us. It's just just don't let it define your day.
There
like,
it is.
If the pressure to look or feel a certain way is gonna define your day, then I think that's where it kind of crosses the line.
You said that really well. Yeah. I feel like you tied that all together in the best way possible. So at the end of the day, regardless of what you want, get the boobs, get the butt, get the whatever it is. If it's you do you. And if you can be transparent about it, because I think that sends a really powerful message if you are for today's adolescents, youth, individuals growing up,
and for our girlfriends, just like your patient who wouldn't tell her best friends how old she was. Let's just keep it real,
right?
Keep it real.
So be you, do you, and do it unapologetically.
Unapologetically. Thank you, Dr. Geoghegan.
Thank you so much.
Plastic Surgery here in Scottsdale. We appreciate you.
We do.
You,
Thank you. As always, I'm Danielle.
And I'm Cindy.
Until next time.